My name is Sarah Musungwa. I am the program specialist for HIV health and development with UNDP. And my position is responsible for the coordination of the Global Fund grants and also other UNDP, other health-related UNDP programs. I think UNDP is well known for being the UN agent that is responsible for poverty reduction, for development, for making sure that there's good governance, for capacity building. We work very closely with governments to give that technical assistance. But we also leverage on that to work in health. So in health, as you know, health is a factor of development. In health, we are looking at human rights. We are looking at governance. We are looking at leaving no one behind. And just to give you also some background, UNDP is one of the 11 founding co-sponsors of UNAIDS. So we are actually, we do partner with UNAIDS. We also partner with the Global Fund. So since 2009, the Global Fund has disbursed over $2.3 billion. And out of the $2.3 billion, just about $2 billion of that was disbursed through UNDP. So UNDP is a nominated interim principal recipient. So we are also a fund administrator of the malaria and TB grants. And in terms of our partnership in country, we are working with 8 what we call sub-recipients. These are recipients of funds from the Global Fund. So we have 8 of them, the major one being the Ministry of Health, and then we have National AIDS Council, we have BRTI, we have MCAZ, we have NATFAM, we have WFP, we have FACT, and we have the Health Services Commission, because we are also administering funds that are channeled through the Health Services Commission for retention of staff. So in terms of our work with the National AIDS Council, we are supporting the Zimbabwe National HIV and AIDS Strategic Plan, which is its objectives and priorities. And what happens really is the Global Fund does not determine the priorities for a country. Those are determined by the country planning processes. So it is this body that actually comes up in a consultative manner. They consult as widely as they can, and they've been doing this very, very, very well. They consult as widely as they can, and they come up with a proposal. What happens then is that they look at the available resources, whether from the government itself or from other funding partners. And then once they do that, they see the gap, and the gap is then submitted to the Global Fund as a funding proposal. So as it is, like I said, we supporting maybe 3 major areas, which is treatment, care and support, prevention, because much as we know that we are doing very well as a country on the 95-95 fast-track targets. I think we have achieved the 95-95 fast-track targets, but we still have pockets of resistance in terms of the key populations. These include the sex workers. I think the last statistics that were available for the sex workers, and I hope I'm correct here, 57% of them were HIV positive. So that is a group to worry about. Then we have the men who have sex with men. Again, evidence, because as UNDP, and I'm sure every organization worth their salt will plan and formulate programs based on evidence. And here evidence is showing us that most of the new cases of HIV are coming from those pockets where some populations are underserved or are excluded because of other issues. And so sex workers, transgender people, men who have sex with men. And recently, we have actually now looked at the people who use and inject drugs. And this is a very new intervention that the Global Fund approved this last, I think the last 2 quarters. We haven't started really doing the work on the ground because there's a lot of work. There's a lot of things that we need to understand before we can embark on that. Recently, we were in Kenya 3 weeks ago as a country under the leadership of National AIDS Council for us to learn how Kenya is doing it, because they have a very good response to people who use and inject drugs. So it's one area that the Global Fund is going to be supporting, and we are really looking forward to that. So, and we also are looking at treatment, diagnosis, and testing. All those things the Global Fund is supporting. We also look at quality assurance and quality control through the MCAZ, Medical Council Authority of Zimbabwe, I think, yeah. And we have the NATF doing our storage and distribution for the pharmaceuticals, and we have WFP doing the storage and logistics for the non-health products, because we also procure a lot of non-health products like bicycles for the village health workers, like uniforms, like printers, all sorts of things. And yeah, basically this is where we are. Yes. And then in terms of success, I want to say that the HIV response for Zimbabwe has been very successful. It is a very comprehensive multi-sectoral approach that looks at making sure that there is treatment, care and support for the people that are affected by these 3 diseases, and that also there is testing, quality assurance, just making sure that even those prevention, those people that are left behind are part of the program. And for that, we have very comprehensive programs that are being implemented by National AIDS Council. The level of commitment in terms of the response to HIV no country matches it, because I think we are the only country, or maybe the first, if there are others, then they copied from us, the first country ever to come up with a National AIDS Trust Fund. And this shows very high level of commitment, political commitment. And if you also look at the aggression to which the country has responded to this epidemic, we are talking about, we had a prevalence of around 20-something% very early, but now we are at 11%. And like I said, most of that 11% is coming from the key populations, and we really want to deal with that so that there is no infection that comes from there, because currently it's actually evident that most of the infection is coming from our key populations. So the Zimbabwean government has really shown commitment to the HIV response.